Hi, my name is Lacey Brumley, and I wanted to start off by telling you a couple things about myself. I am in my third year of college here at East Central and recently got accepted into the Occupational Therapy Assistant program starting in January. Experiencing a loss of an ability that once seemed so simple or struggling with activities others accomplish so easily can be devastating. Occupational therapy is a growing field open to the possibility of living one's life to the fullest and gaining or regaining the ability to do and accomplish the tasks required by our daily lives. I want to connect, inspire, and provide my future patients with the best care possible. To do that, I felt it was important for me to understand how communication tactics differ from one patient to another depending on the age group and situational needs that are present. After the conclusion of my informative speech, my audience will understand the importance of effective communication within the health field and furthermore the profession of occupational therapy. In its entirety, the health field requires utmost integrity and sincerity of those who choose to enter it. We will start out with the basics in communication that should be practiced by all health field employees and then branch into OT. The U.S. Department of Health and Human Services outlays the Health Insurance Portability and Accountability Act, privacy rule, otherwise known as HIPAA, stating that the information between a healthcare provider and patient's personal information is exactly that, personal, and it should be kept private. Disclosure is inevitable in healthcare, and thus it is that much more important for us to uphold this law, whether it be shared verbally, medical records, or anything pertaining to the patient's personal information. That is our job, to keep that as secret and uphold that to the patient. Focused listening is another tactic that should be employed when dealing with a patient. Personal subjects are commonly shared, sometimes making the patient feel uncomfortable. It is the healthcare provider's job to practice empathy and really listen to what the person has to say and how they feel. Use of self is another extremely effective component used by a variety of different workforces, including occupational therapy, social work, teaching, and many more. Authors of the segment Doing Good by Knowing Who You Are, the instrumental self as an agent of change. Seashore, Shawver, Thomas, and Mater describe it further. Use of self is to link the concepts of self-awareness, perceptions, choices, and actions as the fundamental building blocks of our capacities to be effective agents of change, hopefully to make a better world and to develop our own potential for doing so to the fullest in the process. It is effective in the way that it genuinely puts the caregiver's personality, ideas, and values on the table, providing a sense of vulnerability that is reciprocated by the patient. It allows authenticity in the relationship between provider and patient, furthering the level of trust, and in turn, effective treatment follows. We briefly discussed occupational therapy before, but now we will go more in depth. The American Association of Occupational Therapy describes the profession this way. Occupational therapists and occupational therapy assistants help people across their lifespan participate in the things they want and need to do through therapeutic use of everyday activities, otherwise known as occupations. Each individual requires a special and specific type of treatment, and thus communication is no different, and they would also require an altered form of communication depending on each person, need, or age. Furthermore, we will start by looking into age differences from pediatric to the elderly. When working in pediatrics, children range from birth to around 7 years of age. Communication with children is a different experience, being that the therapist has to constantly keep the attention of the child. Additionally, integration of more playful communication is necessary to make the child feel comfortable and ready for the task at hand. For example, I shadowed a woman at an outpatient hospital setting for pediatric OT and got the chance to meet some of the children. One in particular had been a micropreemie at birth, meaning he was only 2 or 3 pounds whenever he was born. He was now 6 years old and he was extremely developmentally behind both in physical and mental state. In order to interact with him in a way that he found interesting, she started off by playing useful games that worked his motor skills, even though he just thought they were playing. When he would get off subject, she would make it lighthearted, maybe tickle him a little bit, and then tell him, explaining that we need to focus again. It was very interesting to see how she worked with him so smoothly, achieving the desired treatments he was there for. Adults that are usually involved in outpatient therapy can range from anywhere to 18 to 40s or 50s. Most therapists employed in this area fall into this age range, so they are considered our peers for the most part. When providing therapy for patients of a similar age, it is very important to relate to them and make them feel comfortable. From personal experience working with people considered peers or the age of my parents' generation, sometimes disagreements can arise, and it is necessary to communicate clearly and overcome differences for efficient therapy to take place. The Health and Care Professions Council of London advises best on situations such as these, saying, "Recognize that relationships with service users should be based on mutual respect and trust, and be able to maintain high levels of care even in situations of personal incompatibility." Mind you, I'm not saying that there will not be difficult situations with other age groups, but sometimes adversity can arise with our peers, and I have noticed that. Care of the elderly usually takes place in a nursing home or home health care, involving those in the age range of 65 and over. Communicating with the elderly can vary from situation to situation. For example, I shadowed an OT at a nursing home where she had to alter her communication when just speaking naturally to when she was speaking with her residents. She had to get in front of one man face to face, literally inches away, and yell at him because he could not hear her because he was 98 and hard of hearing. However, a very important note, as listed in the article sponsored by the Western Governors University, instead of approaching this person with a preconceived notion that they are hard of hearing or experiencing dementia, first communicate with them as if they have no issues in hearing or comprehension. As you continue to hold the conversation, you can make necessary adjustments. Additionally, in therapy, a certain level of discomfort can arise, so it is necessary to pay attention to nonverbal cues, cluing therapists in on whether their therapy is too strenuous or not and if they need to alter it. Over the course of my speech, we learned some general tactics for communication within the health field, including the secrecy and level of trust enabled by HIPAA, focused listening, and use of self. We then broke into occupational therapy, discussing what its main goal is in providing the public with the ability to do the daily tasks in their lives and live their lives to the fullest. Because occupational therapy varies over a broad spectrum of fields, we then divided different care tactics into age groups. With children, communication should be involved with more playful tactics, actively keeping the child engaged and focused. With adults, communication should make them feel comfortable, and a level of trust and mutual reciprocation should be present. If a personal conflict arises, we discussed that it is best to put it aside and provide quality care, regardless of personality differences. Elderly individuals can often be hard of hearing, but it is important to adjust accordingly and not to create a barrier that makes them feel uncomfortable. Thank you for your time, and I hope you enjoyed my insight on this growing, wonderful field and understand the importance of effective communication within occupational therapy.